what sort of studies have been done on it as far as?
Well, it's interesting because it's nice that 10 years ago, when I started this, when I first learned about it, I went to the library and I did a search to see what kind of information was out there. And I think I found one article. I just was doing some research to prepare another proposal today, and I just found that there were 40 articles. Now, they're not all pro, but there's a lot more interest in it, and there's been a lot more experience with it. And we have some studies that are pretty well definitive in terms of showing an improvement in terms of people's behavior, in terms of their symptomatic responses, improvements in post-traumatic stress. So there is information out there. The difficulty with it is that it doesn't fit standard paradigms for how people operate or how healing occurs. It's not cognitive, which is the standard way the most common way that we understand psychological change in today. So it sort of bypasses the cognitive and does things that the cognitive can't, because you don't have to tell the story again in order for this to work. You just have to think about it, remember it, to experience the sensation, and then you can tap on these meridian treatment points and it will change the way you experience it. So it's very different in that sense that it doesn't fit a standard model. It doesn't fit a standard medical model because we're not injecting people with a drug that's going to change the biochemical directly. But we do know we're changing biochemical, because if you're changing how you feel, you're changing the chemistry of your body. We also have pretty strong evidence using something called heart rate variability, which is the measure of the difference between the heart rate when it's in sympathetic dominance versus parasympathetic dominance, and that we're able to change heart rate variability with thought field therapy, with tapping, when no other things are going to do that. Heart rate variability has been around for about 30 years, 35 years. It's still used in obstetrics today. There's been a couple thousand studies done with it. It's actually considered to be the best predictor of mortality after a cardiac event. The Framingham studies out of Harvard have done gone back and looked at the studies. They've been looking at the same families for generations, and they've been studying heart rate variability, and they find that that will tell you how long someone's going to survive. It's also a predictor of overall health. Thought field therapy can change that. There's very few things that will change heart rate variability in a positive way. So it's considered to be a placebo-free indicator of health and of measurement of change. It's possible there are drugs that will change your heart rate variability. If you give somebody one of those drugs and you give somebody a placebo and you say this will change your heart rate variability, normally with that we would expect there would be some placebo effect. There is no placebo effect. That's why we say it's a placebo-free measure. And that's one of the strongest indicators that we have that thought field therapy is doing something at a very fundamental level in terms of how we operate.